Okay, good. Excellent.
Alrighty, how exciting is this to do a live? I've never done this before, so I'm super excited to do this.
Yes,
Um,
absolutely.
but we've got some people already in here. People have waved to us. Yay, exciting. Today is Stress Awareness Day, which is why we are doing this to talk about stress, mental health, cardiovascular. So I'm super excited. Let's
Hi.
see if more people, let's take a second and see if more people
Sure.
jump
Yeah,
on. Yeah, before we really get into this great conversation that we are going to have.
absolutely.
All right, it's 10:02. Let's go ahead and jump in. So,
Yeah, let's do it.
I'm going to introduce myself. I'm Dr. Tanika Gayle. I'm a clinical psychologist. I am head of DEI at OOTify, and I am the owner of Collaborative Psychology Group and Visionary Consulting. For those that are curious about OOTify, Oot means lift up in the Hindu language. And the vision is to lift up and nurture sustainable human health. If anybody knows me, you know that is so authentic and true to me. I am all about lifting up others individually, community, and standing in the gap for those in need. I have joining me Dr. Rigved Tadwalkar. He is an expert and consulting cardiologist with Pacific Heart Institute. He is a fellow of the American College of Cardiology and the American College of Physicians and is board certified in cardiovascular disease, echocardiography, cardiovascular CT, nuclear cardiology, and internal medicine. God, you're doing a lot there. He provides a full range of non-invasive and invasive diagnostics, as well as conventional and novel therapies. He's definitely an emerging voice in the field. He joined the Forbes Health Advisory Board in 2022, supporting their mission and helping individuals make smarter and less stressful health decisions. He also serves on the Medical Review Board of Prevention Magazine and is a medical reviewer for Insider. Last but certainly not the end of all of his accomplishments, he has been elected to the Super Doctors Rising Stars list annually and selected as top doctor by Los Angeles Magazine. I will say we share one thing in common. I was selected top doctor for Inland Empire magazine
Mhm.
about 3 years ago.
I
So,
I love it. Yeah, and
yeah.
absolutely. And I want to thank you so much for the introduction and for the generous introduction, I should say. And quite honestly, in the time that we've taken to come up with topics, go over things, it's been absolutely amazing working with you on this. So I'm super excited about our event today.
Great. So, as I started off by saying, today is Stress Awareness Day. So, we are really going to discuss the intersection of stress, mental health, and cardiovascular disease. So, we know that there is nobody that is immune to stress, right? We all have felt stress one way or another. It is really a normal part of life. But we also know that when we become extremely overwhelmed by stress, it can lead to mental health problems and or it make existing health problems worse. Some of the mental health problems we know that can come from stress are anxiety disorders such as panic attacks, post-traumatic stress disorder, generalized stress disorders, as well as disorders. And all of this impacts one's level of functioning, right? From a medical perspective, though, with stress, my understanding is that the body releases hormones such as adrenaline and cortisol. And additionally, stress causes the body to go into that fight or flight response, right? Can you discuss these factors? How do they contribute to cardiovascular disease? How to decrease and mitigate some of this, and what folks can do under stress?
Yeah, absolutely. So it's a wonderful question, and it's a great place to start in terms of framing the discussion. So first and foremost, it's important to establish that psychiatric disease, which includes anxiety and depression, can lead to cardiovascular disease, and vice versa. 'Cause we often don't think about the other side of the relationship. For example, if you have a heart attack or have another cardiovascular issue like a stroke, that might make you anxious and depressed because this is a big life change. So that bidirectional relationship is well established, although the mechanisms behind it we are still exploring and we're still trying to understand. However, of what we know, the mechanisms are likely multifactorial with a biological underpinning, including some of the things that you had mentioned previously. So there's this, there could also be psychological and genetic mechanisms involved as well, and all of that's being elucidated. One that's probably of most interest is that, and probably most well validated, I should say, is that mental illness has been implicated in dysfunction of what we call the autonomic nervous system. So stepping back for a second,
Yeah, tell us about what is the autonomic nervous system for not everybody who knows those words.
And some of you may sort of have a flashback back to high school biology because they talk about the system and all the different parts, and there's many different components to the nervous system. So we'll sort of step back and without getting too long-winded, just kind of go through the different categories. But you have two major categories of the nervous system, the central nervous system and the peripheral nervous system. And the central nervous system includes the brain and the spinal cord, and the peripheral nervous system sort of includes everything else. And it includes a motor and sensory component. And then this is further subdivided into the somatic or voluntary functions, so somatic nervous system, and the autonomic function, which is the involuntary function. Autonomic component, which is the involuntary functions. And that's what I was focused on. Now, the thing to remember within the autonomic nervous system is that there's the sympathetic and the parasympathetic nervous system. And this is alluded to a lot. So if you look at the literature or you read about this stuff, you hear different opposing, somewhat opposing portions of the nervous system. And that fight or flight response that you had referenced comes down to the functions of the sympathetic nervous system in general. So basically, when we think about the sympathetic nervous system, we're thinking about that response when, for example, you experience fear or you're getting ready to run or do activity, sort of like that increase in heart rate, maybe a little bit of sweating, that nervous. These are some of the classic responses that, one can sort of associate with the sympathetic nervous system. Whereas with the parasympathetic nervous system, that's more of like the rest and digest response, which is kind of like a moniker to remember kind of what it does. But it is the kind of response you'd get, say, after a large Thanksgiving meal, where you're sort of relaxed, you're not looking to sort of get into that zone where you're getting ready to do it.
And so go ahead. And so if we are staying in that flight or fight response for a period of time, what ultimately happens to us?
Yes, so this is very important. So mental illness has been associated with activation of that sympathetic nervous system. So it's really that response that is sort of ongoing that leads to things like decreased heart rate variability, increased variability in the QT interval, which is one of the things that we look at on an EKG. But things that people would really notice, high blood pressure, and hyperactivity of the endocrine system, particularly something called the HPA axis, which is the hypothalamic pituitary adrenal axis. And basically, these are all separate organs in the body that are in communication with each other due to hormones. So we have a dysregulation of this system and increase of stress hormones like the ones that you mentioned, like cortisol. And this is that stress response, that excess cortisol that can have a number of systemic effects. So beyond just the things that we discussed with the sympathetic nervous system that activate, they can include things that are related to fatigue, depression. This includes weight gain as well, immunity. Like there's a whole variety of different things that are associated with an excess of cortisol and these stress hormones. And we think that this is a large reason as to how mental illness is, sort of implicated when we talk about the nervous system and how that interacts and how the body can affect the mind.
Jumping into medication management a little bit here, because we know that whether it's anxiety meds and or medication for depression, it can cause weight gain, as you were just mentioning, and some other symptoms. Is there a causation between the medications used to reduce psychiatric disorders and cardiovascular disease?
Yeah, so in terms of medications, when we're talking about this, and I do want to sort of, just to step back for a second, in terms of
Yeah.
other things where we see some, shared activity between, the body and psychiatric disease. So we know that with an increase in stress hormones, we could have increased inflammation, increased platelet reactivity, and this kind of all forms the basis behind, this relationship. Now, in terms of
Mhm.
there's a number of clinically significant interactions. Now, I kind of want to start with interactions between psychotropic and cardiovascular drugs, with the notable interactions for popular drugs would be those with SSRIs, so selective serotonin reuptake inhibitors. And for those who have had depression, most likely they've been prescribed this medication at some point. Even some people who have anxiety might be prescribed this. And this
Mhm.
can be implicated in increased activity of a number of antithrombotic medications. So if somebody is on blood thinners for cardiovascular disease, then SSRIs can be implicated in this increased activity. So this needs to be watched carefully. Other psychotropic drugs can increase beta blocker, calcium channel blocker concentrations. These are medications we use commonly for cardiovascular disease. And even in some cases, some psychotropic drugs can sort of interact with antiarrhythmic drugs. So these are all things to be aware of.
So what you're speaking of really reminds me of just like the importance of holistic care. So when somebody comes in, they're definitely going to be needing to tell their doctor, hey, I am taking these psychotropic medications, so that whatever medications the cardiologist also prescribes, that there are no counterindications from the two types of meds coming together. I do want to make a little transition to bipolar disorder and mood disorder, such as depression, right? One of the criteria markers for mood disorders can be, like I said earlier, that increase in weight as well as decrease in energy, which are concerning symptoms. How might these symptoms increase one's risk of cardiovascular disease, and what can one do to offset that increase?
Sure. It's actually a great question. And it can be a little bit challenging actually in the clinical realm
Mm-hmm.
to and have a good solution to. But this increase in weight or decrease in energy that you speak of may both independently act to induce or further worsen risk factors for cardiovascular disease, namely obesity and insulin resistance, or what we also call glucose intolerance, which is basically the precursor to diabetes. It can also
Mm.
conditions such as high blood pressure, hypertension, hyperlipidemia, high cholesterol, and sleep apnea, which is something that is often not discussed, but is a very important and emerging cardiovascular risk factor. But the others are also established risk factors for cardiovascular disease, including ischemic heart disease, which is disease of the blood vessels of the heart. So basically, when this occurs, or when we're sort of faced with this situation, a patient in particular should be following these changes to their body, including their weight, when they start these medications,
Mm-hmm.
when they know that this could be a side effect. They should also
Mm-hmm.
check their blood pressure periodically and have really close care with their primary physician in the process, or perhaps other specialists as well, so that, when these things are occurring, in real time, they're getting the type of feedback that they need to decide, where to go. Now, in terms
Yeah.
of offsetting it, easy answer obviously would be to aim treatments at these conditions that can develop as a side effect. But I realize that, there could be some objection to this, because then, some people feel like, hey, we're giving one drug to solve a problem and then causing another in return. But
Absolutely.
but there is a wide variety of options out there, and it's worth discussing with the physician whether medication regimens that can be amended to get the medicines to work for people in the way that they would like, in a more holistic way,
Mhm.
And other doctors should be able to do what they can in terms of their own level of expertise, within a medical team to address this issue as well. So in many cases, it might just be about seeing the prescribing physician again to see what the alternatives are. So because we're in this amazing era of modern medicine, fortunately, there are options to try to mitigate some of these issues.
Where would you say we are in the field as it relates to the overlap of cardiac and mental health care?
It's still poor as a whole.
Yeah.
Unfortunately, psychiatric disease is often not identified in a cardiology office, and when it is, it's often not addressed.
Mhm.
Typically because one isn't really looking for it. And it could also be that sometimes, quite honestly, in a cardiology office, cardiologists aren't necessarily interested. Or even if they were, they don't really have the time to go and address it, um, or the resources for that matter. But we know that addressing psychiatric or mental health issues will often improve outcomes. And if in no other way than in terms of quality of life, because that's a very important metric. Now, to be fair, studies that look at the effects of behavioral interventions on cardiovascular outcomes have been mixed. But this underscores the fact that maybe we need better coordination and deployment of these interventions uh,
Mhm.
work the way that they are intended. Um,
Mhm.
we know that pharmacologic interventions may be helpful, but at the same time, we want to ensure that those side effects are not apparent as well.
Is cardio psychiatry or cardio mental health, as I like to call it, is that the future? Is that where we are headed?
I believe it is. The emergence of mental health as a parameter of importance has impacted all fields of medicine. So
Mhm.
things that maybe wasn't talked about before was sort of siloed into a separate category. But cardiopsychiatry in particular, as a field, is still developing. It's just being talked about in the cardiology community, and it's just recently, and you could even argue it hasn't really quite gotten there, but that we're sort of developing a call to action for those who want to be involved to start developing some pathways, bringing this to the forefront, create a conceptual framework that's going to work, and to be able to expand on the field through conversation, clinical care,
Mhm.
meeting, research. Like basically, we need to establish that apparatus. And I think now that there is that awareness, that would really be the next reasonable step.
How would you say OOTify fits into this picture? Because, right, this is the platform that we do. We come in, we help enterprises, but you speak to that.
Yeah, absolutely. So, in terms of mental health support, OOTify is like the type of platform that really is needed in today's sort of medical community. And the reason for that is that we really just do lack resources as a whole. Even
Mhm.
those that are involved in the space, for example, a primary care office or a primary provider or physician, where they are actively screening for psychiatric disease, oftentimes they don't really quite have the resources available to be able to plug people in. And the truth is that if you wanted to go see um, perhaps a psychologist or a psychiatrist for that matter, it may actually be difficult to find one that's in your network or
Right.
that insurance covers or that takes insurance as a whole. Like there's many that are just private pay and they've sort of gone that route,
Mhm.
unfortunately. But OOTify is a wonderful organization to be in the sense that they're able to fill this gap. This is like a very strong need here. And to be able to plug individuals in readily with the type of mental health care that they need to support their overall wellness. It's really the type of organization that has been sorely needed within healthcare.
And I will just add with OOTify, right? We have mental health services, we have nutritional services, we have a lot of different interventions that we use because it is about holistic care, sustainable health care. And we know not one service fits one person. So we do like to customize based on, and that is why we make these partnerships with folks so that we can provide the necessary services that definitely are lacking. Um, Going back to us, though, what are some of the common psychiatric symptoms that mimic cardiovascular disease?
Sure. This is a popular question because people really want to know when they're having symptoms, is this coming from
Mm-hmm.
the heart or is it something else? Because obviously if it's coming from the heart, then that really changes what they decide to do in terms of their care. So palpitations, irregular heartbeat, this is probably the biggest one. And for those who don't really identify with the term palpitations or don't know what that means, basically this is the sensation that the heart is beating irregularly. Now, the challenge there is several-fold. Without getting too into depth, but still providing some clarity, the biggest challenge is determining whether that's really just a normal heart rhythm with anxiety superimposed, right, when someone's feeling this, or if
Mm-hmm.
there is anxiety or other sort of psychiatric disturbance, as we like to say, that's causing the heart rate to speed up. And this is the normal sort of response to that anxiety or other stimulus. The other part of it is just identifying whether this is a true arrhythmia, so an actual change in the rhythm of the heart, and if that is the thing that's causing psychological stress. So admittedly, this can be a little bit challenging, but we often see that over. The same happens with chest pain and with shortness of breath as well. And the classic example that I give people outside of palpitations as like a very common, psychiatric issue that overlaps with cardiac is panic attacks. So
Yes.
the tough part about panic attacks is they can completely mimic heart attack symptoms, especially for someone who isn't used to having panic attacks.
Mm-hmm.
This can be very challenging to tease apart, and rightfully it comes into the clinical arena because it should. It is something that needs to be teased apart. What often is a silver lining with this is that people who have panic attacks oftentimes will have multiple panic attacks. They sort of know what they feel like to them, and they're
Right.
characteristic. They last for a specific period of time.
Yes.
And so once there's education there, like, hey, this is your panic attack, and
Mm-hmm.
I know I'm having that sort of thing, then it can be a little bit easier to tease apart whether this is coming from the heart or not. Now, I'm not asking that people go self-diagnose, but once they've sort of sorted this out or sorted it out with the help of a healthcare professional, a primary doctor, a cardiologist, it might be easier to sort of identify these issues, but admittedly, they are common symptoms, and this is why it's important when you do have symptoms to just have it checked out. It never hurts.
How are you identifying patients that need mental health support? How do you do that in your practice?
Sure. For myself, seeing so many patients every single day for so many years, it's actually pretty easy for me to spot when someone needs mental health services or whether there's psychological distress or
Mm-hmm.
illness that might potentially be there. The tougher part for me, just kind of alluding back to the prior part of our conversation, is like doing something about it, because we're not really trained to do something about it as cardiologists. Like I know how to do it because of my training in medical school and just coming up through rotations and different
Mm-hmm.
of my physician career, but that's not my focus. I'm there to focus on cardiovascular issues, and theoretically somebody else is supposed to be working on the mental health issue. The challenging part is that there might not be someone working on the mental health. A lot of people,
Correct.
care doctors or their primary care doctors, are not well equipped, and they don't have the apparatus, and that's really where a service like OOTify can really step in and bridge that gap.
Yeah, that partnership. Absolutely. This I feel is a very important question, and I think it's just so systemic in nature. How are you combating disparities that are happening in the healthcare system regarding cardiac care, whether it's gender, race, socioeconomic status? How are you combating the disparities?
Absolutely. So the first step is to acknowledge that there's an issue. Because historically, with certain groups, women, those of other genders, minorities, we know that the receipt of care is poorer. And these are real,
Mm-hmm.
they're not just based on that are based on studies. They're not just sort of made up. But there's still a lot of people there, out there, even in today's era, that deny this. So again, I do want to point out first and foremost that acknowledgement is important. The second part of it is unlearning a lot of what is already ingrained in us. So once that education is there about the unconscious biases, we have to pull ourselves out of those patterns, and it does take practice, right? It's not something that happens overnight. It's something that
Right.
takes a little bit of, it's uncomfortable. It requires constant awareness. It's a bit of a emotional and sort of, battle each time potentially,
Mhm.
but it's very important. And hopefully, and I want to say it has been helpful in medicine. I want to say in general, via a more diverse workforce, for us to sort of be more committed to bring that awareness and teach it and learn it and be able to put it into practice. So in my own personal practice, I try to uncover any unconscious biases whenever I can by asking why. For example, like, why shouldn't we provide certain therapies or options to specific people or certain individuals earlier in their disease course as opposed to later? And
Mhm.
make those connections to try to really delve down into where those disparities might lie in terms of care. So I really try to bridge that gap within my patient care. Oftentimes, those from marginalized groups, those from different socioeconomic backgrounds, maybe that are not as health literate or haven't had access to such, I try to take some additional time to educate them on what's happening and try to get them up to speed, even if it means that we're taking a little bit of longer time, to
Yeah.
discuss that within the visit. I feel
Mhm.
that's a better use of that visit than sometimes even getting down to like the nitty gritty of their issues. Not that they're like their physical issues or their
Yeah.
cardiovascular issues. Not that those aren't important. It's just that sometimes, hey, we can wait a few weeks if that means that, hey, we are really educating you on this aspect of your care.
Would you say you and your colleagues are having these hard conversations to be more intentional and have the awareness?
I think it's happening more. It's not still quite there completely, but I see it happening
Mhm.
for a generation of physicians. And
Mhm.
patients will recognize this as well. And in fact,
Yeah.
the number of individuals who want to see younger physicians now as compared to older physicians, even older patients, is actually really surprising. And I think this is part of the reason is like there's just so much more awareness in terms of how to provide better care. To try to dissolve some of those disparities, because many of those unconscious biases that we discussed earlier are not really even thought about in an older physician community. They didn't even come up with this concept.
Mhm.
Or are they really thinking about it day to day? But oftentimes as a younger physician, when I see their management style, I'm sort of seeing it have sort of play out in front
Yeah.
of me. So I think it's kind of interesting how that works.
Are there any trends on demographics, as well as are there any hesitations with certain demographics seeking care?
Yeah, so I love this question because it just gets down to the heart of really what OOTify is about and really
Yeah.
what the conversation is about. And the interesting thing about mental health is that everybody can be affected. Nobody is spared from the possibility of having a mental health issue, because if you're a human being, you can be affected by this. You're composed of the same cells and organs and endocrine system and all those wonderful things that we alluded to earlier, all
Yes.
scientific structures. And I do also believe that part of it's a generational problem as well, with younger people being more affected. Now, part of that, I think, quite honestly, is just the process of growing up, experience, hormones. Like there's a whole lot of different aspects that are sort of part of this, but especially in today's era, because we don't really quite have the social structures that we had in the past that human beings thrive on in terms of,
Mhm.
and social isolation now is more prevalent than ever. Uh,
Mhm.
quite honestly, it's easy to do when you have a computer, an internet connection in your own place. I mean, it's like easy to hole up and just sort of, that's what you think of as society and as community.
Yeah.
So the mental health issue is prevalent. But in terms of demographics, this is where it gets kind of interesting, and it's sort of a big question, because I guess to answer your question, are there any hesitations with certain demographics seeking care? The short answer is yes. But the longer answer is that it's for many different reasons, because it depends on the community. And there's a lot of overlap within all this. But if you look at traditionally marginalized groups when it comes to healthcare in general, all you have to do is look back at history. For example, in the African American population, African American community, there's hesitation because of a history of experimentation. We don't have to go any further than Tuskegee experiments, to sort of see that a dark part of medical history and the history of country for that matter. Moreover, because of poor racial ethnic relations historically in all sectors of life, especially then and even now to a degree, why would it be any different in healthcare? Like, why should someone go trust the healthcare apparatus, after that, or after
Right.
that we're seeing in day-to-day life when you're living this? So obviously there's going to be that hesitation. It's generational. It's not something that just goes away after one generation. These are like real big societal issues that years, decades, centuries to overcome. So, there's always that hesitation there from that side of it. Now, for those who, switching gears a little bit, for those who may, have come from a different background, speak different languages, there is a language barrier. It doesn't matter if you have a translator in the room, you're not going to really quite get that same translation of what somebody is feeling, how they can sort of express themselves especially when it comes to mental health issues. So, I think that's also very important to remember when we look at, hesitation with certain demographics. Now, I can tell you from personal experience, just to kind of, again, switch gears, in terms of the Asian and South Asian community, there's a big stigma to not only seeking care, but just acknowledging it in the first place. And I know this is a big theme with OOTify and really in the South Asian community as a whole. There's always like the, what are people going to think, type of issue if I'm having this problem. And then, of course, for younger individuals, Asians, South Asians, talking to your parents is like not even really an option, because they're just going to say, okay, well, get over it. What's the problem? And they're not really seeing that this is like there's a biological underpinning or causality to some of these issues. It's not just, all in your head, quote unquote.
Right.
So, I love that now in today's era, I would say in the last several years especially, and of course, with the proliferation of social media, the work that OOTify has done, the South Asian community has done, other individuals, and really just in all communities, like there's really a spotlight on mental health now. And I think taking away the stigma is going to be huge. It's going to be amazing for the next generation. So I think now that we're having these difficult conversations and those conversations are normalized, we're going to be in a much better place. And I'm very hopeful, at least, for the future.
I as well. In closing, what are some of the best practices you would say that we should begin to engage in?
Sure. So this is a popular question because oftentimes now there are individuals so first of all, some people may not even be aware that there's a mental health issue brewing, but then have the awareness and they've sort of followed the appropriate channels and they've kind of, seen from their healthcare providers, they sort of learned that this is the case. They want to sort of pull themselves out of it. Or maybe individuals now, after listening to a conversation like this, understand that they need to sort of be prophylactic or preventative to prevent this from happening. There are a number of different things that you can do to just improve your mental well-being as well as your physical well-being. And what I like to often tell people, I say this all the time, is that those things are free. You do not need anything special for this. You don't need equipment. You don't need to go to a special place. You don't need a fancy gym. In many instances, this is free. And so I would start with, obviously, the physical piece of it, which I do highly advise that every individual, to the extent that they physically can, should participate in physical activity, whatever that may be, even for people who hate exercise. Like literally hate exercise. They're like, I will do anything except for exercise. I tell them, even 30 minutes of walking 5 times a week, okay? 30 minutes 5 times a week. That could even be like on a treadmill while you're watching one episode of your favorite show. 5 times a week. That in total will actually satisfy your physical activity requirement as defined by the American Heart Association. So this is like really important to remember that, it doesn't necessarily require you to go be an athlete. A lot of times, we're so stuck on this idea that like, in order to be physically active, we have to emulate what we see on television. Like now I need to be an NBA player or a CrossFit. Like it doesn't really work that way in real life. Any kind of physical activity counts. And some people may say, okay, well, that's great. But how do I know that's doing anything for me? And I will tell you, as a medical doctor, that every little bit counts. You may not see the results up front. Depending on the level of activity, you may not physically necessarily even see results, but certainly in terms of mental transformation, in terms of cardiometabolic health parameters, laboratory values, potentially weight, like all these different things will improve. And certainly if you are interested in exercise, then this is definitely a very easy way to sort of take care of both your mental and physical health, because as we've seen from our conversation today, there's a lot of overlap between the two.
Yeah.
I also want to allude to diet as well. Now, of course, that's a challenging conversation because
Yeah.
fortunately here in the United States, and I would venture to say in most societies now, just because of big corporations, we're unfortunately, the food around us is pretty terrible, like, to be perfectly honest. I mean, when you're hungry, which is a normal human thing to experience, is hunger, right? On the first thing you're going to see at any corner is a fast food restaurant, right?
Mm-hmm. Mm-hmm.
Fast food is exactly that. It's just fast food, right? There is not really a high quality component to fast food. And so what I tell people is, like, you really need to spend a day just planning out, like, in your head, when you're coming up with a schedule, you need to plan out, like, what are you going to do in terms of meals that day? But if it includes that I'm going to hit the corner and hit the fast food joint, that's not really an appropriate plan, right? So, you need food that's going to nurture your mind, body, and soul, right? That's what we often like to say, right? And
Yes.
the
Yes.
quality of food is important. But beyond even the food itself, types of food obviously are important. And from a cardiac standpoint, which should also support your mental well-being, of course, we like to focus on whole grains, fruits and vegetables, nuts, specific types of fats, and oil. And so there's a whole thing behind it. It's really like a separate conversation altogether. But certainly,
It really is. And I will just jump in. I'll just jump in and say, unfortunately, the healthier types of food are more expensive than going and getting fast food. So that there becomes a barrier to eating, in a healthier way, because fruits and vegetables can be more expensive than just going out to McDonald's or such. So how do I think that is a barrier that we've got to begin to tackle.
Yeah. Go ahead.
And then I think, you and I earlier were having a conversation because being from different communities, many diets are geared towards things that our families may not necessarily eat or enjoy. So how do we bring older populations into, okay, this is more so a heart-friendly diet, but it is inclusive of the foods that we also eat?
It's challenging. Notably, it's challenging. Basically, the problem is that, cultural expectations often trump sort of what you may do, on a day-to-day basis. So you could have, especially for those of us from, these other backgrounds, I guess, if that's what you want to call it, non-Caucasian backgrounds, non-mainstream backgrounds. You can have the best diet, best activity, and have a beautiful day-to-day routine. But then once family gets put into the picture and cultural obligations a part of it, things can really fall off the bandwagon. It's really difficult to stick and adhere to that. What's important to remember, and I often will tell people to do, and it works with variable success because I realize there's not one solution to it, is one is obviously for those who are stakeholders, so people who are basically in your life and are an important part of your life, it's important to have this conversation with them. Like, listen, I enjoy the food that you make. I don't know if I can eat all of it because it's not really doing the best for me right now in terms of health. And, that's always a good place to start. And people may variably listen, but certainly having more people on your team is helpful, because then in those situations when that meal sort of, comes to you, at least there is some thinking for the person who's making it, or for others who are involved in your life, that, hey, like, this may or may not, be the best for you, and how do we sort of modify that meal? I'd say the best piece of advice, though, quite honestly, that I can give, because I know it goes a lot deeper than that, and that might not be practical for a lot of people, is that in that situation, I tell people to modify their portion. So you can eat just about everything, just modify the portion. So as opposed to sort of having this big plate with a lot of everything, on it, then if it turns out that the food in front of you is unhealthy, or you know that it's unhealthy, or there's something that maybe you shouldn't eat too much of, just have a little bit. There's no problem with that. And if it means just taking a smaller portion, no big deal. And it will really save you in the end, because a lot of weight management has to do with just portion control. And ultimately, like, lower calories will, win the game.
What would you say are the values that you hold most dear that impact and guide you as a physician?
Well, oh yeah, okay, that's an interesting question.
Completely off script, right?
Yeah, extremely. That's a wonderful question. I think it's just seeing humanity do well. A lot of the struggles that we face are internal. They really are. Like, a lot of what we externalize, comes from an internal struggle. And unfortunately, when it comes to human health, like, nothing's guaranteed. You could be the richest person, you could be fabulous, you could be traveling the world, have everything at your fingertips. But once your health unravels, like, that's essentially and that becomes a big source of problems. You could have, again, $1 billion, but if you can't walk, for example, worth, or how does that change your quality of life, for an extreme example. But it comes up a lot, if you have troubles or any other problem, which can just happen organically. Even if you're healthy, these things can happen. It's sort of how what led me into this field. And it's also the principle I sort of live by, is that your individual quality of life could be amazing if we can tackle your health issues. And health is just part of that quality of life and quantity of life. So anything that I can do personally to, get you to that next step, or get you past that health issue and live your best life, is really what I'm all about. And that's kind of what guides me on a day-to-day basis, among a whole plethora of other things.
Thank you for that. Oh my goodness, it's been 42 minutes we've been having this conversation, and it has gone by so fast. Is there anything else you want to say before I wrap us up?
Just a couple of points. One is that, we had an abbreviated discussion about, cardiovascular drugs and sort of side effects, adverse consequences, like that. It's a bigger discussion, probably better for a different time as well. But I do want to point that for many people, this is when we're talking about, because the topic is really that mind-heart-body connection, it's important to realize that certain cardiovascular drugs can also have, psychiatric, can be associated with psychological disturbances, and vice versa. But from a big picture perspective, I would just close out with just wanting to say thanks to the OOTify organization. Thank you, for taking the time to interview and just having such a big interest in this. I want to thank Ravi Sharma, Nicole Sharma, basically the whole team at OOTify. I mean, I think the work that they've done is tremendous. They've been trailblazing. They've been bold, really just working hard every day on something that they really believe in, and to really bring this to the forefront to a lot of communities who don't really have this conversation. So I see really big things for OOTify. It's been like an absolute pleasure to be, part of the organization, and I'm looking forward to continuing my work with them in the clinical realm on a day-to-day basis, and really getting people plugged into the resources that they need.
Thank you for having this dialogue with me. Thank all of those that were in our chat and watching. If you are a doctor in a clinic, business, university, and your focus is mental health and inclusive holistic care, please reach out to OOTify. You can find us on our Instagram. Our website is OOTify, OOTify.com. And we are more than willing to partner with you and provide you the necessary services that you need. So thank you all, and goodbye.
Thank you.